Washington Journal continues.
For our program now, Tad DeHaven of the Cato Institute. He serves as a budget analyst and joining us to talk about Social Security disability insurance. Thanks for joining us.
Thanks for having me on.
Most people are familiar with Social Security, but as far as the disability insurance portion, for those who may not know, what does it cover?
Yes, SSDI was created in 1956. It wasn't part of the original Social Security program, and from the beginning, various officials in Washington wanted to have a disability component, but most people thought it would be too expensive. Eventually they got it after World War II in 1956, and the idea is if you become permanently disabled, then you have this program that basically covers part of your wages, and you have to work. And originally it was 0.5% of your wage. Now it's 1.8%. And the original program, it was supposed to be people 50 to 64, and then if you became permanently disabled, and then you would go on regular Social Security. And this is back when we had more of a blue-collar workforce, and things have changed, and like a lot of government programs, it's become a lot bigger. It's become something that it wasn't supposed to. Eventually, it was expanded to cover everybody, and the process has become very complex and eligibility liberalized, and so that's kind of why we're in this situation now.
What situation is that?
Well, the trust fund is going to be bankrupt by 2016. Put simply, the taxes coming in are not enough to pay the benefits, and it's a situation that's only going to get worse. And the reason is we have more and more people going on SSDI, and you just don't have enough taxpayers out there, basically workers paying for those who are on the disability rules.
So as far as who qualifies, first and foremost, what qualifies as a disability?
Well, and that's where we get into trouble because it's very subjective. It used to be that the disability had to be of a permanent, very long-term nature. Now it only has to last as much as 12 months. And the considerations that are used to determine disability are much more subjective. And so, and if you look at the history of it, in particular in the 1980s, there was a backlash against attempts to rein in the system. Congress responded by changing the process. And so nowadays, people qualify on the basis of musculoskeletal disorders, depression, mental disorders. Those form the majority of reasons people collect disability. But again, especially when you get to appeals level and things like that, when people ask for benefits, it's very subjective, and it's very hard to determine if somebody truly is completely disabled and if that's a permanent disability.
So are you saying that initially when the program started it was for back injuries or things that would take you out of work if you had a physical job or other issues, but it was mainly a physical kind of ailment?
It was seen as a transition. Again, this is largely when we had a more blue-collar workforce of people approaching their retirement ages whose bodies were broken down, yes, and they were permanently, completely disabled.
Our guest is joining us to talk about the Social Security disability insurance and issues he sees with it. If you want to call and comment on it, or perhaps you're even a recipient yourself, you have the ability to do so this morning. Here are the lines this morning. It's for Republicans, 202-585-3881. For Democrats, 202-585-3880. And for independents, it's 202-585-3882. Now, if you are receiving Social Security disability insurance and you want to give your thoughts or at least your perspective on this, here's a number for you to call. It's 202-585-3883. And you can always send us a tweet at C-SPAN WJ as well. The numbers involved currently in SSDI, what are they?
It's going to be spending of about $144 billion this year, and adjusted for inflation, that's basically doubled since the year 2000. And if you look at the number of people collecting disability benefits as a ratio to the workforce, that's doubled since the 90s. And if you think about it, again, we're a less blue-collar, less hard labor workforce. We have all kinds of wonderful new health technologies and medicines and assistive devices that should make it easier for people to work. If surveys and government numbers show that people aren't actually more disabled, yet you have this doubling of the number of people collecting versus people out there working, and that points to some sort of problem. And, you know, I would point out there are people who have a permanent disability that need help. Nobody's disputing that. But there's something amiss with this program if you look at the growth, and then when you start to investigate and look at this program and see the inherent subjectivity in it, it's clearly something that needs to be addressed by Congress.
Why hasn't a clear standard been made?
Well, disability is an elastic concept, as a former SSA administrator said, and so there's been numerous attempts through the years to narrow down this definitions and coming up with listings of impairments that the SSA and the disability determination offices are supposed to use, and that's given way to these medical vocational guidelines called the grids, and that's supposed to take into account people's age, their education. And then when you get into issues like mental illness and back pain, people out there can ask themselves, you know, at some point in my life, I've had back pain or I've had anxiety or I've had, and it's, again, especially when you get to the appeals level, if a claimant appeals to a judge, if they've been turned down by the SSA, it's very hard to look at somebody and listen to them and say, yes, you're completely disabled, or no, you're not completely disabled.
We'll talk about that appeals process in a second, but some of the numbers, according to 2013 estimates, 10.9 million people, total of Americans receiving those benefits. 8.8 million receiving benefits are disabled workers. 2.1 million receiving benefits are spouses and children. Now, why are they included in this?
This is just part of the program expansions as it went on through the years.
From the expected SSDI trust fund expenses, you heard the guest talk about $144 billion, $111 billion expected revenue in the trust fund will take in, and that research projects of the SSDI trust fund will be depleted, that the trust fund will be depleted by 2016. As far as a future is concerned, some of the analysis that's done saying that in the past, Congress has eliminated those potential shortfalls by shifting money within the Social Security budget and the SSDI budget. And they said they've done like 12, 15 times in the history of this program. Why not just do that again to cover the cost?
Right. And realistically speaking, and look, there's not a lot of people talking about this issue on Capitol Hill. And you'd think that there would be some concern or members of Congress dealing with it for the reasons you just said. It certainly would appear to me, and having worked in the Senate and worked around some of these folks, that this is an issue that they don't really want to get too involved in. If you go back to the Carter administration, because back in the late 70s, they were facing a lot of the same problems they're facing today. The Carter administration attempted a crackdown. The Reagan administration followed through with it. Well, there was a tremendous backlash. As a result of that backlash, Congress actually ended up making it easier to get disability benefits. And so, look, this is a very emotional issue. This is a tough issue. And the average member of Congress doesn't want to deal with people protesting outside their offices, handicapped or what have you. And so there's not a lot of gumption to go around to tackle this problem and admit that there's a problem, that this thing has become something that it was never supposed to be.
So your estimation would be that Congress would indeed shift funds around in order to cover the cost?
If I was a betting man, I'd say look for the Band-Aid.
Tad DeHaven of the Cato Institute, and he's a budget analyst for that organization, joining us to talk about this. Robert is from Miami, Florida, on our Democrats line, and you're the first call. Good morning.
Good morning, Pedro.
You're on, sir. Go ahead.
Yes, hi, Pedro. Hey, I don't understand one part of this issue here. What do they consider disability?
Thanks, caller. I think we talked about it a little, but if you wanted to go further as far as how it's clarified.
Yeah, I mean, it's supposed to be to limit your substantial gainful activity for a period lasting at least 12 months. And then you get into what that actually means. Well, that's a decision that's made by a state determination office. If it's appealed, then it goes to the law judge. It can be appealed after that, but then there's various criteria that are taken into consideration whether that standard is met.
Dee Fredericks from Twitter says the Social Security Trust is in fairly good shape. The disability component is clearly being abused. Financial shortfall real. How do those square with your analysis?
Yeah, well, I mean, look, let's look at the trust fund is basically an accounting fiction. Trust fund's made up of worthless IOUs. So this program's already in serious trouble, and regular Social Security is going to be in the same boat here very soon. So when they redeem these securities to make up for this shortfall, it's coming out of general funds, which means we're basically borrowing it. So the problem's already here. It's just if you want to go along with Washington accounting, then in 2016 you have the real problem.
Like I said, we set aside a line for those of you this morning who receive this type of insurance. Mario joins us from Bridgeport, Connecticut, Democrats line. Mario, good morning.
Good morning. How are you doing?
I'm well, thanks.
Okay, what I wanted to state was that I received disability, and I've received it for quite a while now. And one thing that I noticed is that, obviously with Social Security disability, they want you to try to work, gainful employment, to try to get off of it after 5 years. The problem is, once you start working, you lose your coverage, your insurance, and you can't pay. The medicines are expensive. Some medicines that I take cost $300 a month, and if I don't have my medicines, I end up back in the hospital. So I lose my job. I end up incurring more problems. I was thinking perhaps now that the Affordable Care Act is being considered, wouldn't that be a great segue for people on disability to be able to work and be able to be gainfully employed and receive benefits so that they could afford their medicines, and there would be less of a recidivism back onto the rolls of Social Security? Thank you.
Mario, before you go, what put you on Social Security in the first, or the disability in the first place?
I prefer not to discuss that. I'm going to just stick with HIPAA on that one. Thank you.
It's hard to say. I just simply say that there's no such thing as a free lunch. Once Obamacare comes in, we've already had a lot of businesses and such indicating that they're going to be cutting people, so it's no guarantee that you're going to be getting such coverage. But the caller does make a point, and this is one of the issues, is 24 months after receiving SSDI benefits, you automatically qualify for Medicare. And so this is a big reason why people choose that option, because then the government picks up the cost of your health care as well. And that's actually one of the big costs here that people don't realize is that the Medicare cost to SSDI beneficiaries is now about $100 billion a year itself.
What's the monthly benefit payment on SSDI?
It depends on your work history. It depends on your previous earnings, but you can't be making more than about $1,100, and so there is a cutoff there, and that does discourage work. That is an issue, and the caller sort of gets to that problem.
James from Katy, Texas. You're up next, Republican line. Hi. James, are you there?
My question is, I've heard that a large number of people that actually live in Puerto Rico can qualify for SSDI. And if that's the case, that just seems outrageous to me.
I think what the caller's referring to is there's a massive fraud situation with SSDI benefits in Puerto Rico. And in fact, this week, the FBI and other government agents they basically raided a bunch of doctors who were being paid to give diagnoses that would help people collect benefits. And they're talking about fraud on the magnitude of over $1 million. And this is one of the problems with the system. And interestingly, they've known about the potential problem being in Puerto Rico for a couple years. Excellent work from a Wall Street Journal reporter named Daniel Paletta first brought this to the world's attention. And the SSA's response was there's nothing out of the ordinary in Puerto Rico. Well, we now know that the SSA was very wrong about that.
Actually, the story this morning goes on to say that the 3 indicted doctors would charge patients a fee, typically $150 to $500, for filling out government paperwork that alleged the applicants weren't able to work when in fact their claimed medical corrections didn't exist.
Yes, and that's not an uncommon problem. And in Puerto Rico, I think the statistic was 9 of the top 10 zip codes in the United States and Puerto Rico that had the highest level of benefits per that zip code were in Puerto Rico. And amazingly, the SSA said that there was nothing out of the ordinary.
Isn't there a framework to follow up, even though the doctors wrote the note? Shouldn't have been some type of framework to follow up on its legitimacy?
There should be, but this is the problem with having a government-run program, especially one run from Washington, is it's very costly. And you have this massive grow in the rolls, and not just the number of people on it, but the number of people applying. The system is broken, and so you have this massive backlog because of the applications, because of the appeals. The SSA is supposed to conduct periodic reviews. They're millions behind on that, and so the system's kind of slumbering along. And again, at this appeals level with these judges, they're so overwhelmed that the SSA has basically instituted quotas. They say they're not quotas, but basically to move things along, speed these things, and the outfit that represents the administrative law judges has said judges are pushing people through the system because it's simply easier and quicker to approve benefits.
Sadie joins us from Silver Spring, Maryland, and receives disability benefits. Sadie, good morning.
Good morning.
You're on, ma'am. Go ahead.
Hi. Yes, I first applied for SSDI benefits in 2002. I had a severe case of thyroid disease. In 2005, I got benefits, but only for one time. And I was working part-time all the time as a contractor. In 2008, it was investigated, and I got SSDI for 6 months, but no Medicare. Oh, I did get Medicare. It was only for a 6-month period of time. Still working part-time as a contractor. 2012, the end of last year, I finally got my SSDI benefits, and I'm continuing to get them now. I still work part-time. That probably was the hardest problem because they kept telling me, don't work, don't work, don't work. But if I didn't work, couldn't pay my bills. So I continued to work.
You said somebody told you to not work. Who was that?
Well, part of the program is that you not work. You're supposed to be so disabled that you can't work. And you also need to apply for SSI and SSDI at the same time. I actually refused the last few years to even apply for SSI because I wanted to work, and I am working, and I continue to work. And I think that was probably part of my problem to get the SSDI, which I didn't figure out till later because I did go without insurance for almost a year and a half.
Are you working full-time or part-time, may I ask?
I work part-time. I actually now have, I've always had a chronic JRA arthritis, and actually that's what I'm receiving, the SSDI for at this present time.
And that's Sadie from Maryland, DeHaven.
Yes, the caller touches on the problem, is she wants to work, but if she works too much, then she loses her benefits.
And she didn't specify that there was a they that was telling her not to work.
Right, which is interesting. I don't know who the they was. I don't know if it's legal firms. There's nonprofit groups that are helping, get people into the system. It's a good question. But yes, no, this points to the problem. The caller brought up SSI, that's Supplemental Security Income. It's sort of a sister program. Basically, a program created in 1974 with the elderly poor in mind. It now largely benefits disabled adults and children. But SSI follows the same disability determination process. That's why it's housed at SSA. But you see this problem with these young kids who oftentimes parents say they're looking for a kid that can pull a check, and that is, find some sort of disability associated with them, collect benefits, but the check goes to the parents. And these kids, a lot of kids who could work or do part-time jobs or start building skills that would help them after they get out of high school, they're not working. And it's a very sad, unfortunate situation. These kids end up not getting skills, and then they end up becoming, identifying themselves with this disability and this incapability of working, and they end up on the rolls permanently.
GAO took a look at this under SSI and said that in the fiscal year 2011, the most prevalent primary mental impairments among children found medically eligible were attention deficit hyperactivity disorder, speech and language delay, and autism, with autism claims growing most rapidly since fiscal year 2000. State disability Determination Services examiners also consider the impact of additional or secondary impairments when making a decision, and when present, these impairments were used to support 55% of those cases that GAO reviewed.
Yes, if there's any teachers out there, and I come from a family of teachers, I've heard this for years, and I'm yet to meet a teacher who disagrees with this, that they're aware of parents trying to get their kids on medication, psychotropic drugs, because they think that with that diagnosis, with them taking drugs will help them get that SSI check. You know, hometown I grew up in, there's a doctor known as Dr. Ritalin because he was known for being an easy prescription. That's a problem, and it's not just the fact that these kids aren't working and they're being labeled and taught to rely on government dependency, but you know, if psychotropic drugs are nothing to play with, and to just have these kids drugged up at such an early age, I think it's a travesty.
Dwight is up next for our guest, DeHaven of Cato Institute, Bronx, New York, independent line.
Good morning. I like everybody to have a great morning. About this SSI check. Hello, can you hear me?
You're on. Go ahead.
Okay. About this SSI check, I believe with the current sequester going on and the government coming back extending, they should not eliminate it, but it needs to be cut back. And I have a question for you guys. What do you think people with brain injuries, how would they fit into this? Thank you very much. Have a good day.
Well, if you have a brain injury and you're disabled and you meet the qualifications, then you get a benefit. And again, I'll just say with both programs, SSI and SSDI, the original intention is for people who just truly could not work to have a safety, a backup, and it's become something that it wasn't supposed to be.
Another benefit recipient. This is Sue from Troy, Missouri, Democrats line. Hi.
Hi. I'm a former paralegal from the Northeast, and I initially got Crohn's disease in 1998, which is a little-known disease that affects your gastroenterology and that system. And I worked through that, and thereafter, in 2001, I was stricken with multiple sclerosis. 25 attacks later, continuing to work with the IV Heplock in my arm at the law firm, I then was told that mentally I really wasn't there. So I had to deal with that, and that's kind of irrelevant. The point of the matter is I'm concerned about the funding of the program that I paid into for 32 years. I'm 47 years old. I sound good. I look good, but I'm not good. And these things are forever. I have scars on my brain. Things are never going to change for me. It is what it is. And I'm very concerned about the funding that you speak of that is not there for me.
Caller, thank you.
Yes, I mean, that's obviously I feel bad for the caller's circumstances. It sounds terrible, but that's why it's important to make sure that these programs are as airtight as possible. I say that, but I think it's impossible, realistically speaking, for the federal government to administer such programs because of the complicated, subjective nature of determining what a true permanent disability is.
According to information we have, about 1.6 million applications for disability insurance in 2008. 900,000 of those were allowed. 100,000 were the number of claims pending at the time that this data was collected. And then it goes to the process of how you apply for it. There's the determination stage. If you're rejected, there's a reconsideration stage. And then there's a series of reconsiderations every time if you are rejected. Why is that built into the system?
Well, I mean, that's part of the situation here is that you have multiple opportunities at the apple if you are denied. And the big problem you have right now is at the appeals level, particularly the administrative law judges. The administrative law judges are employees of the Social Security Administration, but they're very independent. And they hear the hearings if a claimant so chooses to appeal a negative decision. And so while most initial applications are rejected, they're rejected in many cases because technical reasons, earning too much money, don't have enough work credits. At the appeals level, once it gets to the law judge, then it's a different story. The majority are successful, and you have some wild numbers out there. You have examples where there was one judge in West Virginia that approved 99.7% of his cases, and you see one judge for back pain approves 90%, another approves 15%, and that sort of gets to the subjective nature of it. But see, most claimants, when they come in there, have a lawyer, and that's the issue of itself. Whereas the taxpayer doesn't have a representative, or if you want to say the government doesn't have a representative. It's supposed to be, you know, kind of a non-adversarial situation. And that's sort of one of the things that I mentioned in my paper, is that at least have somebody in the room representing the interest of taxpayers here, and because these lawyers get paid to do one thing, and that's to get people on the system.
How widespread of an industry is that?
Well, if you've ever watched TV, particularly this time of day or throughout the day, you might see the guy with the cowboy hat, binder and binder, depending on what state you live in. There's certain big firms. You have these specialty law firms that figure it out, because you don't make a ton of money per case. But in 2004, they made it easier for claimants to be represented by non-lawyers. So you hire a bunch of people on the cheap, and you run a bunch of people through the system, and you can turn out a lot of money. I think the Wall Street Journal reported that Binder & Binder made $88 million in 2010. And the amount of money that taxpayers have spent on legal fees is now over $1 billion. And
now, you said the taxpayers spent on legal fees, but you had just said that the government should have a representative to go against the lawyers, or maybe I misheard you.
The government being funded by the taxpayer. Everything the government does, we're paying for. So if the government's represented, then I mean that to be that the taxpayer interest is being represented.
Jeffrey is up next for our guest, Tad DeHaven of Cato. Levittown, Pennsylvania, Republican line. Hi.
Hi, how you doing? Nice to be on C-SPAN. This is my first time calling in. My question is that I've been fighting for my disability for almost 2006 up until now, and I just got the appeals thing again back, and I got to go back in front of an ACA judge. I was wondering, how come I got to keep on fighting for it? I mean, if they dismiss the judge's thing, I should be able to get it, right?
Well, it sounds to me like the Social Security Administration and the law judge you spoke to disagrees.
Brenda, up next. Good morning. From Tallahassee, Florida, Republican line. And,
yes, I would like to say thank you for this opportunity. My first point is the gentleman said that there are worthless IOUs in SSDI fund. A worthless IOU means it's theft. You're borrowing money from a fund to support, and putting IOUs in there means it's theft. You're taking from taxpayers, and you're not. I think you get my point. Number two, I worked for 35 years. 35 years, and I paid into the system for 35 years. It took me almost 3 years and medical records about 3 inches thick to get my disability. I have heart disease. It's a condition that kills members of my family anywhere from 27 on up. Last year I was diagnosed with breast cancer. So I'm glad I hung in there and I fought for it, but I could have gone broke trying. I could have lost my home trying because of the debate that goes on. Luckily, I had an attorney. I knew to get an attorney early on to protect me. But I would like to say that the people that are wasting this fund are people that have hardly worked any, that are claiming to be personality disorders, mental illness such as, well, you know what I'm talking about.
So, caller, in your 3 years of working for this, how many times did you go to the appeals process, and what was the kind of involvement there?
I was actually initially turned down right away, And they tell you that's what happens. And then I went back a second time, and I went with an attorney. And in that process of having an attorney, it took me almost 3 years to get my disability.
Mr. DeHaven.
Luckily,
Thank you, caller.
Yes, this is an emotional, tough subject, and you do hear a lot of these stories, and there is resentment from folks who are truly permanently disabled that the system is being abused. But the question is what to do about it, and there's really no easy solutions here, especially in the political environment that we find ourselves in.
You talked about previous attempts to put controls on the program and how they fared. In your mind, going forward, is there a way, a best practice as far as determining who can actually be disabled and who's not? Or is this something that should be defunded altogether in your mind?
Yes, I mean, I think in the long term we should be looking to move this, at least devolving it down to the state level. You have state determination offices to begin with, so the states are involved. But any situation where you can get the private sector more involved, the better. I have a friend who represents companies for workers' compensation claims. You know, the company's represented. And again, the taxpayer isn't, and that's an inherent problem. But unfortunately, the politics are tough here. As we've heard from these various callers, it's a very emotional issue. And I'm sorry to say, but the average member of Congress isn't going to want to stick their neck out on this.
And no one's made efforts to type of reforms for the system?
I'm not aware of anything substantive. There might be some talking going on. I think Congressman Issa had a hearing on it, but there's look, Washington, Congress is very good at naming post offices after people. Taking on the entire disability system that's been there for 60 years and has all these weeds and problems, that's going to be an awful lot of work.
Our next call comes on the Democrats line from Harbor Springs, Michigan. This is Kathy. Hello.
Good morning, Pedro. Mr. DeHaven. Mr. DeHaven, I have to speak to this autism conversation that you had. I worked in that population for 4 years, and there was very little medication for the entire population of the school. My son, who doesn't have any disability, was in a public school last year, and it was suggested that he go on some type of medication for attention deficit, which he doesn't have, and I had to come down very hard on the school through the school board members. I know a young man who was in a child care situation with my sons. Several boys were hurt, including my children. And this young man has significant mental health issues, which he is finally, I think, going to get disability for. It's my hope that he doesn't have to stand on it forever, but I believe he will. He needs that. He will never be able to work, I think, productively in society. And it's a very sad situation. The government didn't do their job to protect the children. Now, I know someone who just retired from, I think, the U.S. Department of Education. He worked as a congressional aide for years. He's a quadriplegic. He's my age. I'm 56. He worked all of his life. He used a pencil-type apparatus in his mouth to type. So people can work that have disabilities, but they shouldn't be punished for that. Now, I live in subsidized housing here, and I'm quite certain my next-door neighbor, who doesn't appear to be disabled to me, she may have COPD, but she's a smoker. I go to work every day, and she doesn't, and it does bother me. It bothers me that she seems to be quite capable of going to work, but doesn't.
Okay. Caller, thank you.
I receive basically two types of responses to my papers so far, and one response is people sharing anecdotes, examples of people abusing the system, and the other is people frustrated with the system because they have problems and it took a long time to get them addressed. And so that was sort of a combination of the two right now. But regardless, I don't think this is, and the more I've looked at this, this isn't really an ideological, it's not a partisan issue. I think this is something that really hits home to people on an emotional level because these issues are prevalent, they are widespread, and they are things that we deal with on a daily basis. And I think having this discussion is healthy. because there's clearly a problem and something has to be done with it. And I've said that a Band-Aid is likely, but hopefully, bringing more attention to it, the gumption can be found in Washington.
Here's the paper that our guest is referencing, The Rising Cost of Social Security Disability Insurance. Ted DeHaven is a budget analyst for the Cato Institute. Paper can be found on the website, I assume, cato.org.
Yes.
What initially prompted you to research this?
Well, I was at Walmart one day and happened to overhear a conversation between two women, and the one woman says to the other, and this is during the recession, and she said, well, I can either take the pay cut or just go on disability. And I stopped because I'm a policy guy and I go through government programs, and I thought, wow, that's really interesting that she sees that as just a alternative and not really even thinking in terms of the disability itself. And so when I went home and I looked at the growth in this program, I thought, wow, why isn't this being addressed? And at Cato, we run a website, downsizinggovernment.org, where we go through each agency, each program. And so it was like, we need to tackle this. And if you go to downsizinggovernment.org, we have an essay on not just the SSDI, but also SSI, Supplemental Security Income, as well as the parent Social Security program.
Next call is Terry from Norman, Oklahoma, Democrats line. Hello.
Yes. I started working when I was 14, full-time, while I was going to school. And during summers, I'd work 3 jobs a lot of times. Worked my whole life. When I became injured, it's workman's comp, and at workman's comp, there's nothing wrong, or you're about to die. Lawyers, it's a welfare for them. The state, I thought, well, I'm hurt. It's clear that I have had a ruptured disc, that I don't, that I need a little medical, treatment. But no, it's, go through this, go through that, do that. There were records that I couldn't get because they were trying to prove that there was nothing wrong with me. But when it proved that there was, then I couldn't get those records because they had paid for those. Now, by the time I got to workman's comp or to Social Security, of course, everybody is rejected. It's just a blanket thing. You're rejected. There are people that have bulging discs, which are nothing but people who are too lazy to get their backs in shape to work, receiving Social Security. But the dirty little fact in this country is that there are zillions and zillions of us who have repetitive trauma injuries. I worked my shoulders until I had spurs that were half the size of your little finger, and the doctor said that everything inside was so shredded that he couldn't tell the bursa from the rotator cuff, and just sewed things back together and removed the spurs.
Caller, thanks.
Again, it's another example of frustration. Based on the caller's story, his body's worn down, he's worn out, and he sees people who aren't in such a situation collecting benefits, and that's hard for him to understand. You
talked about inactivity of members of Congress to do something. Does it have oversight, or this program oversight from a committee on Congress, and how often do they meet on these kind of things?
I'm not aware of a lot of activity on this issue. I mean, it's the committees in charge of Social Security, because both programs are administered by the Social Security Administration. But again, and unfortunately, the fact that you have the trust fund, whatever you think of the trust fund, going bankrupt in 2016, the fact that we're really not talking about it, and that I'm just sort of discovering it myself as a budget guy because I happen to overhear a conversation at Walmart, that points to me that the fix is probably in, and that they'll just, again, use the parent Social Security fund to mask over the problem.
Let's take one more call from Renee, Starksville, Mississippi, Independent line.
Yes. First of all, I'd like to ask the gentleman who owns the Cato Institute. And I have a number of questions, but answer that one.
Who owns it? We're a nonprofit.
Koch brothers put in a bid to buy you, and we all know what the Koch brothers stand for. You said there's no taxpayer representation during the hearing. The judge does that. The lawyers don't get paid unless they win the case, and by and large, they don't win the case. The problem here is the cost of health care is rising faster than inflation, and that's true in education. This man is, and Pedro, please put the vital statistics of the people that you have on your show on the screen and have a different opinion across the table, like you used to do when Brian Lamb was there. Thank you very much.
You can respond if you wish. Any of that?
Look, it's an emotional issue. These are tough things that need tackled, and this isn't just about taxpayers and the money. This is also about the disabled, and as when I was talking about SSI and the situation with some of these kids and the psychotropic medicines and not working because I don't want to jeopardize mom and dad's check. Look, I don't care who foots Cato's bill or my bill or anything else. That's a human interest and a concern that I have and that a lot of other people share, and there's something needs to be done about it. And it's not just the Libertarian Cato Institute saying it, it's other outfits and organizations across the political spectrum.
Tad DeHaven with the Cato Institute, a budget analyst, cato.org, if you want to find out more about the organization itself, talking about Social Security disability. Thank you for your time.
Thank you, Pedro.